Welcome to OST 149 Cyber Safety Lesson 2 Data Protection and Health IT Security. Brought to you by the Nighthawk Cyber Alliance. Building on what you learned in Lesson 1 about your legal and ethical responsibilities, this lesson goes deeper into the systems that store patient data, how those systems get attacked, and what specific controls are required to protect them. By the end of this lesson, you will understand how electronic health records work, why they are the primary target for cyber criminals, and what every healthcare worker needs to know to protect them. Electronic health records, or EHRs, are digital versions of patients' paper charts. They contain comprehensive medical histories, diagnoses, medications, and treatment plans. What makes EHRs powerful is also what makes them dangerous. They allow authorized providers to share critical patient data in real time across healthcare systems. That connectivity is essential for quality care, but it also creates significant security vulnerabilities. EHRs contain highly sensitive patient data, enable real-time sharing across systems, and that same connectivity is exactly what attackers look to exploit. The HIPAA security rule mandates that every healthcare organization implements safeguards to protect electronic protected health information, known as EPHI. This is a federal requirement that applies to every system that stores, processes, or transmits patient data. No exceptions. The rule requires three things: confidentiality, integrity, and availability of patient data at all times. Organizations must also identify and document potential threats to EPHI, and every patient data system in the organization must comply. This is not optional, and it is not limited to the IT department. The foundation of data security in healthcare is built on three principles, known as the CIA triad: confidentiality, integrity, and availability. Confidentiality means only authorized personnel can access protected health information. Unauthorized access is a HIPAA violation that exposes organizations to serious legal penalties. Integrity means patient data must remain accurate and unaltered except through proper authorization. Unauthorized modifications can lead to dangerous clinical errors. Availability means health records must be accessible to authorized users when needed for patient care. System downtime, whether from an attack or a failure, can directly compromise treatment decisions. Human factors remain the primary attack vector for EHR breaches. Attackers exploit employee mistakes, weak credentials, and unpatched systems to gain initial access, then move laterally through networks to compromise entire healthcare environments. The three most common entry points are phishing and stolen credentials, unpatched software vulnerabilities, and lateral network movement. Phishing tricks employees into revealing login credentials or clicking on malicious links. Outdated software contains known security flaws that attackers exploit to bypass controls. And once inside, attackers move through the network. This can cause data breaches from employees simply downloading the wrong file. This is known as ransomware. Ransomware is malicious software that encrypts files and demands payment for their release. In healthcare, these attacks do not just create financial problems, they cripple clinical operations entirely. When ransomware hits, providers are forced to revert to manual processes and paper records while patient care hangs in the balance. In May 2024, Ascension Health suffered a devastating ransomware attack that started with a single employee downloading a malicious file. Attackers moved laterally through the network, ultimately compromising 7 servers and disrupting operations across 142 hospitals for nearly 6 weeks. The breach exposed the protected health information of 5.6 million patients. This case is a critical lesson in how one human error can cascade into a system-wide catastrophe, and why employee cybersecurity awareness and robust network segmentation are not optional investments. Not all threats come from outside the organization. Insider threats represent one of the most challenging security risks in healthcare precisely because insiders already have legitimate access to systems and patient data, making their actions harder to detect and prevent. Unauthorized employee access, curious or disgruntled staff browsing records they have no business reason to view, and former employees whose credentials were not promptly revoked are all real insider threat scenarios. Organizations must implement robust access controls, regular access reviews, and monitoring systems to identify suspicious behavior patterns before significant damage occurs. Medical identity theft occurs when criminals use stolen patient information to fraudulently obtain healthcare services, prescription medications, or financial benefits. The consequences go far beyond financial harm. When a criminal uses stolen PHI to receive care under someone else's identity, the victim's medical record gets altered, and those altered records can lead to dangerous treatment errors for the real patient down the line. Victims are often unaware for months or even years that their identity has been used this way, which is part of what makes medical identity theft so damaging and so difficult to resolve. Healthcare organizations rely heavily on external vendors for everything from billing to data storage. That dependency creates significant security gaps that attackers actively exploit. Most PHI breaches occur through vendors rather than hospitals directly, meaning attackers go after the softer target in the supply chain. All vendors that handle PHI are legally bound by HIPAA regulations, and one vendor breach can affect multiple healthcare organizations simultaneously. The interconnected nature of healthcare data sharing means vendor security is not someone else's problem. It is directly your organization's problem. Business Associate Agreements, known as BAAs, are legally required contracts between covered entities and any third-party vendor that handles protected health information. Before any vendor receives patient data, a BAA must be signed. Without that contract, sharing PHI is itself a HIPAA violation. BAs define exactly how vendors may use PHI, what security safeguards must be in place, and how breaches must be reported. They also mandate that vendors implement administrative, physical, and technical safeguards equivalent to HIPAA requirements. Without a compliant BAA, both the covered entity and the vendor face significant legal exposure. Health Information Exchanges, or HIES, enable the secure electronic sharing of patient data between healthcare providers, specialists, hospitals, and pharmacies. This connectivity improves care coordination by giving authorized providers real-time access to complete patient histories, reducing duplicate testing, and supporting better clinical decisions. But while HIS enhance patient care, they also amplify security risks. Every organization connected to an HIE becomes a potential entry point for attackers. A single breach at one connected organization can cascade across the entire network, potentially exposing patient data from multiple healthcare systems at once. Encryption is the process of converting readable data into an unreadable format that can only be deciphered with the correct decryption key. It protects patient information both when stored and during transmission across networks. Data at rest, stored on servers, databases, and devices, must be encrypted so that even stolen hardware cannot be read. Data in transit, emails, file transfers, communications between facilities, must also be encrypted to prevent interception. And here is the legal bonus. Under HIPAA, properly encrypted data that is breached does not require patient notification. That safe harbor provision makes encryption one of the most valuable security investments a healthcare organization can make. Audit controls are essential technical safeguards that create a complete record of who accessed patient data, when, and what actions they performed. Every access, modification, and deletion of EPHI must be automatically recorded, including user identification, timestamps, and the specific data accessed. Organizations must retain these logs for required periods and conduct regular reviews to identify unauthorized access or unusual activity patterns. Inadequate or absent audit controls are frequently cited in OCR enforcement actions. Without proper logging, an organization cannot demonstrate compliance or investigate a breach. Missing logs are themselves a HIPAA violation. Automatic logoff is a HIPAA-mandated technical safeguard that terminates inactive user sessions after a set period. It is one of the simplest controls in the Healthcare Security Toolkit and one of the most consistently overlooked in practice. When a healthcare worker steps away from a workstation and leaves the session open, anyone who walks by has potential access to patient data on that screen. Automatic logoff closes that window by ending inactive sessions automatically, preventing unauthorized individuals from viewing unattended screens. It also compensates for the reality of busy clinical environments where staff simply forget to log out during hectic shifts. Data integrity ensures that electronic health records remain accurate, complete, and unaltered, except through authorized processes. Patient records must reflect true medical history, diagnoses, medications, and treatment plans. Because inaccurate data can lead directly to misdiagnosis, wrong treatments, and potentially fatal errors. Tampered records can show incorrect allergies, wrong blood types, or falsified test results, and healthcare workers relying on that compromised data may administer harmful treatments without knowing anything is wrong. HIPAA requires covered entities to implement electronic mechanisms to verify that EPHI has not been altered or destroyed in an unauthorized manner, including checksums, digital signatures, version control, and audit trails. Risk analysis forms the cornerstone of every effective healthcare security program. HIPAA requires covered entities to conduct systematic assessments, identifying potential threats to EPHI, and documenting appropriate safeguards. Organizations must methodically identify and assess all potential risks across systems, processes, and personnel. That assessment must be written down and it must be updated regularly, especially when new technologies are adopted or significant operational changes occur. Missing or incomplete risk analyses are among the most common findings in OCR investigations, frequently resulting in significant penalties. As you saw in the Montefiore case from Lesson 1, failure to conduct a proper risk analysis is the single most cited HIPAA violation. On February 21st, 2024, Change Healthcare suffered a Black Hat ransomware attack that became the largest healthcare data breach in United States history. The protected health information of 190 million individuals was stolen. The attack caused nationwide disruption of healthcare claims processing for weeks, affecting pharmacies, hospitals, and providers across the entire country. Payment systems came to a halt, forcing healthcare organizations to implement emergency manual processes and creating financial chaos throughout the industry. This was not a breach at a hospital. It was a breach at a payment processing company that cascaded across the entire healthcare system. The Change Healthcare breach teaches three clear lessons that apply to every healthcare worker. First, stolen credentials were exploited to gain initial access. Without multi-factor authentication in place, a single compromised password opened the door to 190 million patient records. Second, poor vendor oversight allowed attackers to move laterally through the environment. Ransomware tools are widely available to even low-skill attackers, which means basic security controls are no longer optional. Third, documented security controls, regular risk assessments, and enforced MFA would have prevented this breach. Most cyber attacks succeed not because they are sophisticated, but because fundamental safeguards were missing. Stolen protected health information fuels a vast underground economy of fraud. When PHI is compromised, criminals exploit it for financial gain through multiple schemes, often leaving victims unaware for months or years. PHI is used for billing fraud, prescription fraud, and insurance fraud. Stolen data is sold on the dark web to multiple criminals, meaning a single breach can result in a patient's information being exploited by dozens of bad actors across different schemes. This is why protecting patient data is not just about privacy. It is about preventing real financial and medical harm to real people. Every device that stores, processes, or transmits ePHI falls under HIPAA security requirements. And that category is broader than most people realize. It includes workstations, laptops, tablets, smartphones, and connected medical equipment. A single misplaced unencrypted laptop can trigger mandatory breach notification affecting thousands of patients and result in significant OCR penalties. IoT medical devices like infusion pumps and imaging systems often run outdated software, making them prime targets for lateral network attacks. If a device touches patient data, HIPAA applies to it. Full stop. Standard text messaging and personal email accounts are not permitted for transmitting PHI under HIPAA regulations. Personal phones and SMS lack the encryption and audit trails that HIPAA requires. Healthcare organizations must use secure messaging platforms with end-to-end encryption, automatic audit logging, and access controls. And here is what catches a lot of healthcare workers off guard. Casual, well-intentioned messages containing patient details also constitute HIPAA violations. A quick text to a colleague asking about a patient's medication, an appointment reminder with health details, sharing a test result through an unsecured channel. All of it is a violation regardless of intent. Always use approved communication channels. Cloud computing offers healthcare organizations scalable storage and processing capabilities, and many organizations now store PHI in cloud environments. But cloud storage introduces unique security considerations that require careful vendor management and ongoing oversight. Cloud storage of PHI is only permitted when the cloud service provider signs a business associate agreement defining security obligations and permitted data uses. Even with a signed BAA, the covered entity remains legally responsible for ensuring appropriate security measures are in place. Cloud misconfigurations, exposed storage buckets, improper access controls are a growing source of healthcare breaches, and the shared security model means your organization must actively manage its side of that equation. When ransomware hits and data gets encrypted, the only way to recover without paying the attackers is to restore from clean backups. That makes backup and recovery the last line of defense against ransomware. And HIPAA takes it seriously. The law requires documented disaster recovery plans and the ability to retrieve exact copies of ePHI. Organizations must maintain retrievable data copies at all times. Offline backups stored separately from the network are essential because ransomware can encrypt connected backups just as easily as live data. And critically, backups that have never been tested may fail during an actual emergency. Regular restoration drills are not optional. They are how you know your recovery plan actually works. Every healthcare worker plays a critical role in protecting patient data, and your daily decisions and habits directly impact EHR security. 4 practices stand above the rest. Always log out when leaving your workstation. Even for a brief absence, lock your screen. Report suspicious activity immediately to your IT security team. Early reporting prevents small incidents from becoming major breaches. Access only the patient records required for your specific job duties. Curiosity-driven access violates HIPAA regardless of intent. And remember that technology alone cannot prevent breaches. Your awareness, your vigilance, and your commitment to security protocols are the strongest defense against cyber threats targeting healthcare data. HIPAA and high-tech guarantee patients fundamental rights over their electronic health information. Patients have the legal right to obtain copies of their electronic health records in the format they request, and healthcare providers must respond within 30 days. Patients can also request an accounting of disclosures, a record showing who accessed their EHR data through electronic systems, giving them visibility into how their sensitive information is being shared and used. And when patients identify errors in their records, they have the right to request amendments, with written explanations required if those requests are denied. Denying patient rights without valid legal justification is itself a HIPAA violation. The threat landscape in healthcare IT is not standing still. AI-powered attacks, blockchain technology, and biometric authentication are reshaping both security tools and threat vectors simultaneously. The attack surface is expanding rapidly. More connected devices, cloud services, and third-party vendors create exponentially more entry points for attackers to exploit. The good news is that foundational security enables adaptation. Organizations that have strong compliance frameworks, documented security controls, and a culture of security awareness are far better positioned to respond to new threats as they emerge than organizations that are still trying to cover the basics.
Electronic health records are both the backbone of modern healthcare and the primary target for cybercriminals seeking valuable patient data. The key takeaway from this lesson is that security vulnerabilities in healthcare arise equally from technical weaknesses and human behavior. One employee action can compromise an entire EHR environment. HIPAA security controls exist because of real-world breaches and legal necessity. Compliance protects patients, it protects your organization, and it protects you personally. The technical controls, the legal requirements, and the case studies you reviewed in this lesson all point to the same conclusion. Security is not someone else's job.
That brings us to the end of OST 149 Cyber Safety Lesson 2, Data Protection and Health IT Security, brought to you by the Nighthawk Cyber Alliance. In this lesson, you covered EHRs and why they are targeted, the CIA triad, how attacks enter healthcare environments, ransomware, insider threats, medical identity theft, vendor liability, encryption, audit controls, the Change Healthcare breach, device security, secure messaging, cloud storage, backup and recovery, patient rights, and your personal role in keeping patient data safe. Take what you have learned here and apply it every day. We will see you in Lesson 3.